Hi everyone, a blessed day to all. Praying that all of you are safe and doing well together with your families and loved ones. Praying that you were able to cope with this online learning, especially during your midterm examination. So welcome to your final term. Before proceeding with our discussion for this week, let me present to you this disclaimer slide. Okay? Okay, so this week we have 6 topics to be discussed. And one of those topics is physical examination 1 or your adult physical assessment. So this is part of your related learning experience under your health assessment section. Okay? Right. Okay, so physical examination 1 includes the following: the health interview. Okay, that includes your general survey and assessment of the head. Of course, in assessing the head, it includes the eyes, the ears, the nose, the mouth, the throat, okay, and the neck. And under your physical examination 1 is your skin and nails assessment. Health assessment is divided into 2 parts. We have lecture and RLE. And under your RLE, it is again divided into 2 parts. Meron din tayong part of lecture and demonstration. So what I'm doing now is part of your lecture in your health assessment RLE. So let us have a review about health assessment. I know you are familiar of this term because we had discussed this during your midterm. Okay, again, so health assessment is an integral part, a very vital part of your nursing care. And it is the basis of doing your nursing process. So the data you gathered from your health assessment is used to plan, to implement, and to evaluate your teaching and care in order to promote an optimal level of health, that is to prevent illness, to restore the health of your patient, and to facilitate coping with disabilities if there is. Okay? There are 4 types of assessment. I know you are familiar with these 4 types of assessment because it was discussed during your midterms. As a review, the first one is the comprehensive assessment, which is usually done when the patient enters a healthcare setting. So meaning, this is usually done for new patient, wherein the patient is a very new to the nurse and you don't have any idea about the patient history and the illness of your client. Okay, so it includes a health history and a complete physical examination from head to toe, utilizing of course your IPPA, the inspection, palpation, percussion, and auscultation technique. Okay, another one is the ongoing portion, or what we call follow-up assessment, which is actually another or form of your focused assessment. Okay, this is usually conducted at regular intervals during care of the patient, especially during admission of your patient, or ginagawa natin to when the patient is in the hospital. Okay, yung the morning shift nurse will do an assessment, and then it will be continued by the afternoon shift, and so on. It focuses on the identified health problems. The third type is what we call the focus assessment. So it is very self-explanatory from the word focus. So meaning you are assessing a specific problem. For example, may problem dun sa lungs. Okay, he will focus on the assessment of the respiratory system. And then the fourth one, or the fourth type of assessment, is the emergency assessment. It is a rapid, focused assessment. It determines potentially fatal situation. Usually, ito yung type of assessment that is utilized in the emergency department. Okay. Learned in your interview lecture that part of your pre-interview is to prepare your patient. Of course, not only yourself, as well as to prepare your patient for the interview. So consider the client's physiologic and psychological needs by explaining the procedure to the client, that is to lower the anxiety of your patient. You ask only relevant questions, focusing only on the health concerns, the health habits, and the lifestyle of your patient. Okay? Avoid na natin yung mga unnecessary questions or marites type of questions. Answer clients' questions directly and honestly. And you have to provide comfort and privacy to the client. How? Of course, you have to manipulate the environment, and you have to close the curtain, the door of your client. Okay. Ask the client to empty the bladder, and ask client to change gown. Of course, para easier ang pag-view ng kanyang body parts during the procedure. And you help the client in undressing when necessary, of course. Okay, so these are the different positions that is usually used in the physical assessment. So each position has its use, of course. For example, the standing position, if you are checking or assessing for the posture of the client, or if you are checking for the spinal column of the client. The sitting position, so if you're checking the anterior and posterior thorax, for example, and then the dorsal, recumbent, and the litotomy position. So if you are checking the genital area or the female genital area. Okay, this is a knee chest position. Okay, if you want to check the rectum or the rectal area, same with the prone position. Okay, supine position if you're assessing the breast, the abdomen, etc. And then the seams position. This is also used for checking the rectal area of the clients, and meron pang other uses. Okay, so here is an example of the positions for examination. These are the positions, these are the areas assessed, the rationale for positioning the client in this type of position, and the limitations of this position. So I will not discuss further these positions and its areas to assess. Okay, so you have to review it later. Okay, so after preparing your client, of course, you have to prepare the environment as well. Okay, so the procedure must be done on the agreed time for assessment. So the schedule should not interfere with meals and the daily routines of your client. So wag naman yung oras ng kakain si client or naliligo si client. And the client should be as free of pain as possible. Okay, be gentle and be sensitive. Okay, if possible, you have to choose a quiet, well-lit warm and private room. Make sure that the equipment are complete and of course in good condition and functioning. You have to check the batteries, okay, the charger, and etc. For your information. So make sure to complete the health history of the client before proceeding with the physical assessment, because this will provide you the baseline data to give you an idea about your client, of who your client is, what is the illness or the disease of your client. Physical assessment is being done to validate the subjective data gathered during the health interview. Diba? Ano muna tayo? Interview. Okay, health history, review of system, and then, of course, the physical examination from head to toe. So in doing physical assessment, you have to ensure clients' safety, privacy, and comfort, of course. And example, expose only the area being examined. Okay, you have to cover the area. For example, you're checking the breast of the client, the right breast of the client. You have to expose only the right breast of the client. And of course, you have to cover the other side or the left breast of your client. And compare the findings on one side of the body to the other side. For example, yung breast, no? You're assessing the breast of the client. You have to compare the size. Is it symmetrical? Yeah, that is an example. Okay, so after you prepare your patient, the environment, of course, you have to check your equipment. Okay, so those are the equipment needed for the physical examination. Stethoscope, this is used to check for the vital signs of the client, to listen for sounds, the heart sounds, the bowel sounds, and etc. Sphygmomanometer, thermometer, weighing scale, stagiometer, or if you don't have one, you can use tape measure, a wristwatch, Snellen chart, or newspaper. So Snellen chart is used to check for far vision, and a newspaper is used to check for near vision. Pen light, gloves, cardboard, that is to cover one eye at a time if you are checking the eyes. Tongue depressor, tuning fork, cotton balls, gauze pad, cotton applicator, alcohol, glass of water. Okay, when you're assessing for the trachea and the thyroid, yan. Ophthalmoscope, receptacle, paper and pen, and tape measure. Okay. So these are, again, the techniques in physical examination. This is, again, a review of those techniques. So the first one is inspection. This is a process of performing deliberate, purposeful observation in a systematic manner. So it is use of your different senses, such as the sight. Of course, you have to use your eyes to observe, hear, okay, to listen, and to smell kung meron bang foul odor, okay. You have to begin with the initial contact and continue all throughout the assessment. So, yung inspection mo is very useful. Okay? Okay, the second cardinal technique of assessment is the palpation. So this assessment technique use the sense of touch. Okay, you will use the dorsal surface of your hands to check for gross measure of temperature. You can use your palmar surface if you are checking for the texture, the shape, the fluid, the size, okay, consistency, and pulsation. So the nurse's hand should be warm. Okay, warm mo muna yan before touching your client. Of course, that is to avoid, and of course, that is for the patient comfort, or kapag if you are touching the uterus, no, yung part of the uterus, if it is cold, pwedeng mag-contract. Yan. So, fingernails must be short para you cannot scratch your client while you are doing the procedure. Okay. Okay, so another technique of health assessment is percussion. It is an act of striking one object against another to produce sound. So as you can see in the picture, okay, if you are checking for the tone, okay, so you can use the third or the middle finger, okay, so you can do like this. So there is an example of how to do this in our demonstration part of this presentation. It is used to assess the location, the shape, the size, and the density of the tissue, particularly for the if you're checking the lungs and the liver. Okay. Okay, so lastly, your auscultation. Okay, this type of assessment technique is used to listen with a stethoscope to a sounds produced within the body. For example, the heart sounds, lung sounds, bowel sounds, and etc. So there are two parts of the stethoscope. Okay, you will be using, of course, your stethoscope. So we have the bell side, which is the smallest part, this one. This is used to listen for low-pitched sound. For example, no, the heart sounds, ayan. Especially the adventitious sounds of the heart. Ayan. So you have to remember this bell low. Ibig sabihin, yung bell is used to listen for a low-pitched sounds. Okay, while the other side, which is the diaphragm, okay, the bigger one, so it is used to listen for high-pitched sound. Example is the vowel sounds. Yeah. So doing the physical assessment, you have to follow the following technique or order of physical assessment. You have to start from head to toe, or what we call the cephalocaudal. Or you have to start from the least invasive to the most invasive. Ibig sabihin, you start first from the external before the internal. Yan. Inspection, palpation, percussion, and auscultation. These are the sequence that you will use except for the abdomen. Okay, babalik rin lang natin yung sequence if you are checking for the abdomen. Okay, ang sequence naman in checking for the abdomen is you have to start first with the inspection. So, tingnan mo muna. Okay, the characteristics. Or malaki ba yung tiyan? Yan ang example. Okay, then next is auscultation, followed by percussion, and lastly, palpation. Okay? So, yun po yung sequence when you are assessing the abdomen. Why? This is to avoid, okay? Or because if you do palpation muna or percussion before auscultation, this might alter the frequency of the vowel sounds. Okay, and then of course it will make your findings less accurate. Okay. Okay, so these are the components of physical assessment. Okay, we have the general survey, and under your general survey is to check for the appearance of your patient. So under your appearance, you have to check for the body build, the posture, and the gait of your client. Is it proportional ba ang kanyang height to her or to his weight? You have to check for the weight of your client. Okay, is it erect or slump ba yung kanyang posture? Coordinated ba yung movement ni client? You can ask the client actually to walk, no? And the pattern of gait. Yan. And then, You have to check for the hygiene and grooming as well. Observation mo about cleanliness. Clean ba si patient? Yung no body odors ba? Yan. Is there a sign of illness? Okay. Does your patient look to her age? Appropriate ba yung look ni client to her age? Okay. You have to check also or assess for the affect, the attitude, or the mood, especially by observing the speech, the facial expression of your client. Is your client in pain? Or ability to relax, or makalakad ng lakad, or nakahawak si patient sa abdomen. Yan. Eye contact, okay, and the behavior of your client. Check also for the cognitive processes that involves the speech content in the patterns, the orientation, oriented ba si patient to time, place, person, okay. Appropriate ba yung kanyang verbal responses to your question? Wala bang flight of ideas? Yan. Remember that part of your general survey is to measure the vital signs of your client. That includes the temperature, the pulse rate, the respiratory rate, and the blood pressure. And it depends to the institution. You can include the fifth vital signs, which is your pain scale. Okay, so depende sa institution. Okay, you have to measure also the height and the weight of your client. In the absence of the table for height versus weight, you can use the following formula. Okay, for example, okay, you have the desirable body weight. Okay, the desirable body weight is equal to A minus B, where A is equal to the height in centimeter minus 100, which is constant. For example, your height is 158 in centimeter. So minus 100, okay, that will give you 58 centimeter. So that will be your A. So to compute for your B, this is equal to A multiplied by 0.10, which is again constant. Okay, so in this example, you have 58 times 0.10. So you have your B as 5.8. Okay, so to compute for the desirable body weight, again, A minus B. So your A is 58 and your B is 5.8. So 58 minus 5.8, that will give you 52.2 kilograms. Okay, this is in kilograms as the desirable body weight. Okay, so to compute for C, okay, we need to compute for C for us to know the lower limit and the upper limit. Ibig sabihin, ito yung most na pinakamababang timbang at pinakamataas na timbang if your height is 158 in centimeter. Okay, to compute for C, you have 52.2, okay, multiplied by 0.10. Okay, so itong 52.2, this is the desirable body weight ng formula times or multiply by 0.10, which is constant again. So that will give you 5.22. So these are the normal range, no? The lower limit and the upper limit. To compute for the lower limit, you have to dBW minus C. Okay, so in this example, you have dBW, which is 52.2 minus your C, which is 5.22. So that is equal to 46.98. So kapag ang height ni patient is 158 cm, yung pinakamababang timbang na pwede sa kanya na within normal pa is 46.98. While the higher limit na pwede sa kanya, okay, is 57.2. 57.42 rather, by using this formula. Okay? So to compute for the body mass index, okay, there are two formulas, pero yung i-give ko lang na example is this formula, which is my favorite, okay? So, body mass index, yung formula natin is equal to 703, okay, which is the constant in this example or in this formula, okay, multiplied by, for example, the weight in pounds is 154 divided by the height in inches. Okay, convert mo na yung height mo into inches. So, 62 squared. Okay, so ito yung ating result. So, the BMI here is 28. So, let's check now if the BMI is still normal or not. Okay. So here, this is the body mass index and the weight status of the client. So yung chinek natin kanina, in the previous slides, ang kanyang BMI is 28. So dito siya na-categorize. Okay? Overweight. So ibig sabihin, below 18.5 is underweight. The normal or the healthy weight is between 24.9 to 18.5. Ito yung lowest, no? 18.5 to 24.9 rather. And then for the overweight, ito na yung 25 above to 29.9. Okay, and then you will be considered obese if your BMI or body mass index is more than 30. Okay. Moving on to the findings of our general appearance, which was discussed in the previous slides. Again, you have to observe for body build, the height, and the weight. So, nakuha mo na yung height, nakuha mo na yung weight of your client. You have computed already the desirable body weight and the, ano pa yung kinompute nyo? The DBW and the BMI or the body mass index. Okay, these are the normal findings. Okay, proportionate yung kanyang body build. It varies with lifestyle. No? Kung ano yung lifestyle niya, mahilig siyang kumain ng mataba, so medyo chubby or mabigat. Deviation from normal, there is excessive thin, napakapayat, okay. Below normal yung kanyang weight, based on sa ating computed desirable body weight, or obese the patient. Okay, observe the client's posture and gait. The normal findings, it should be relaxed, erect posture, and coordinated movement. Deviations from normal, the patient look tense, nakaslouch, probably may in pain si client or may problem with the lungs. Bent posture, uncoordinated yung kanyang movement, might tremor si patient. Yan. Observe the client's overall hygiene and grooming. Of course, the client should look clean and neat, of course. Deviation from normals, dirty, and unkempt. Okay. Note for the body and breath odor in relation to the activity level. Of course, the normal, there should be no body odor, or if there is, it should be minor body odor. It should be related to work or exercise. Baka gagaling lang ni patient naglakad or nag-exercise. Deviations is of course foul body odor. There is an ammonia odor, acetone breath odor, or a foul breath. This could be a sign of illness. Okay, acetone breath could be a sign of diabetes. Yeah. Observe for signs of distress in posture or in facial expression. Of course, the normal, there is no distress noted sa facial expression pa lang. Deviations, there is bending over because of abdominal pain. There is labored breathing or difficulty of breathing, of course. You have to note obvious signs of health or illness. Example, in the skin color or the breathing of their client, hirap siyang huminga, ayan. Okay, so part of your general survey, the overall findings should be healthy appearance. Okay, deviations from normal. There is a pallor, weakness, and obvious signs of illness. You have to note the client's affect or mood by assessing the appropriateness of the client's response. For normal findings, of course, the response of your client should be appropriate to the situations or related to your questions. Okay, deviations, there is an inappropriate answers or response to the situation. So you have to listen also for the quantity of speech, the quality, and the organization of speech. Okay, the normal findings, the speech is understandable. It is moderate in pace. It exhibits a thought association. There is no flight of ideas. Okay, for deviations from normal, there could be a rapid or slow pace. It uses generalization, or there is a lack of associations, and it exhibits confabulation. Okay, those are examples of your deviations or abnormal findings. So listen for the relevance and organization of thoughts. For normal, it should be a logical sequence, it makes sense, and it has a sense of reality. Hindi yung, yun na nga, malayo sa katotohanan ang kanyang mga answers to your questions. Of course, the deviations from normal, it is a logical sequence. Of course, there is flight of ideas and confusions. Okay, medyo na dito si patient to answer your questions. Now let's proceed to the skin. After doing the general survey or the appearance of your client, let's proceed. The next step is to check the skin of your client. Of course, again, your skin is the largest organ of our body. So integumentary structures assess our skin, the nails, the hair, and the scalp. Okay, assessed by observation, and you can use your palpation as well. Begins with an overall inspection of the skin conditions, and this can be assessed during other body system assessment. Okay, so hindi naman skin lang ako, start mo na ako sa taas hanggang head to toe, sabi ni mami. So pwede naman you start muna dito, so you're observing the skin, and then as you go along, you have to check the skin pa din. Yan. So for the skin, you have to inspect for the skin color. Of course, these are the findings. The normal versus the deviations from normal. Okay, the skin varies from light to deep brown. Okay, ruddy pink to light pink. Yellow overtones to olive. That's the color of the skin, the normal color of the skin. Okay, deviations could be pallor or paleness of the skin. Okay, jaundice or the yellow color of the skin. This could be a sign of a problem in the liver. Cyanosis, or there is bluish or grayish discoloration of the skin. There could be problem with the blood circulation. Erythema of the skin or redness of the skin. There could be inflammation on a specific area. These are just example of the skin color abnormalities. No, this is a cyanosis, pallor, erythema, and this is jaundice. You can observe the yellowish color of the sclera. Okay, so inspect the skin for the uniformity of color. Okay, these are the normal findings. and on the other side is the deviation from normal. So generally, it is uniform in color except in the areas that are exposed to sun. Areas of lighter pigmentation are the palms, the lips, the nail beds, especially in the dark-skinned people. So deviation from normal, areas of either there could be hyperpigmentation or hypopigmentation, for example, the vitiligo, albinism, or there is an edema. So I have discussed this already in your lecture part. Okay, this is another abnormality. No, ito yung edema. Yung example natin in the previous slides is vitiligo and albinism, the color of the hair. Yan. Okay, another illustrations of abnormalities in the skin uniformity is the hypopigmentation and the hyperpigmentation. So, ito may naging whitish, no? Ito yung vitiligo. Hyperpigmentation, ng dami ng mga pigments or freckles. Yan. So another example of abnormalities in skin elasticity. No, this is when you are checking for the skin turgor. Okay, you have to pinch, okay, the area or the forearm, okay, if the skin brings back to normal, okay. The skin with the crease turgor remains elevated, okay, after being pulled up and released. There could be this could be a sign of dehydration. Okay, this is another example of pitting edema. Okay, inspect for the skin vascularity. These are the normal findings. No, there is an absence of bruising or bleeding on the skin. While the abnormal findings includes ecchymosis and petechiae. So if these are present, you have to assess the location, the color, and the size. So this image is an example of ecchymosis, wherein there is a collection of blood in the subcutaneous tissue that cause the purplish discoloration, usually due to injury or if there is a problem with the blood disorders. Okay, petechiae, this is an example of usually found in the patient with dengue. This is a small hemorrhagic spots that is caused by capillary bleeding. So inspect also for the skin lesions. Okay, the normal findings are the freckles, some birthmarks, some flat and raised nevi or moles. There should be no abrasions and other lesions. The deviations from normal includes various interruptions in the skin integrity. For example, there is macule, papule, pustule, nodule, wheal, tumor, vesicle, and etc. So these are just example of skin lesions, no pustules, and itsura ng mga pustules. Okay, moving on. So palpate the skin for temperature using the dorsum of your hand and palpate for the texture using your palm and moisture as well. And then you can check for the skin turgor by pinching, okay, or pinching the forearm. Okay, and then to check for the skin moisture, these are the findings, normal and the abnormal findings. So moisture in the skin folds and the axillae, these are usually normal or it varies with environmental temperature and humidity for body temperature and activity of the person. Okay, so deviations from normal includes excessive moisture, example in hyperthermia or mataas yung temperature, or there is an excessive dryness in the patient with dehydration, as you can see in this picture. So palpate again for the skin temperature. The temperature should be uniform and within normal range. Okay, deviations from normal, there is generalized hyperthermia. Example for fever. When we say generalized, buo talaga, mainit. Generalized hypothermia, example in shock. Or there is localized hyperthermia, example in infection in particular area. And localized hypothermia in one area lang could be there is a problem in arteriosclerosis. Alright, proceeding with the skin turgor to check for the fullness or elasticity of the skin. The normal findings is that when pinched, the skin brings or springs back to a previous state. Okay, deviations from normal, the skin stays pinched or tented or it moves back slowly. For example, in dehydration. Okay, in edema, there would be difficulty in lifting the skin fold. If there is pitting edema, an indentation may remain after the pressure is released. Okay, moving forward to the nails. We have to inspect the nail plate for the shape. Okay, for curvature and angle. So the normal findings, it is convex curvature. The angle between the nail and the nail bed is about 160 degrees. The deviation, there could be a spoon nail, like you can see in this picture, or the clubbing of the nails, okay, or there is a 180 degrees or above that. So let's now inspect the nail bed color. So the normal findings is highly vascular and pink in light skin client. And for the dark skin client, they may have brown or black pigmentation in longitudinal streaks. The abnormal findings, there is a bluish or purplish tint, particularly for those clients with cyanosis. Pallor that may reflect poor arterial circulation. Okay, so this is an illustrations of abnormalities in the nail bed. So we have here the cyanosis and the other one is the jaundice of the nails. Now let's proceed in inspecting nail texture. Okay, the normal findings, it should be smooth texture, and then the deviations from normal, there is excessive thickness, excessive thinness, or presence of grooves or furrows, or there is a views line. So as you can see in this illustration. Okay. So these are just illustrations of abnormalities in nail shape and texture. This is an example of view lines, okay? A late clubbing of the nails, a pitting nails, especially for those who have psoriasis, early clubbing, no? And the spoon nails and paronychia. Di masyadong kita yung paronychia here. Okay, so this is just another examples of abnormalities, another image. Okay, inspect also for the tissue surrounding the nails. The normal findings is intact epidermis. Okay, deviations from normals, there is a hangnails or paronychia, or there is an inflammation around the nails. Yan. So you have also to perform blanch test to check for capillary refill. Yan, iba-blanch mo lang. So yung capillary refill must appear within 2 seconds. That's the normal one. Okay, So for capillary refill, again, the normal findings, there is the prompt return of pink or usual color within 2 seconds. Deviation, there is a delayed return of pink or usual color that may indicate circulatory impairment. Alright, so this is the end of the first part of this physical examination 1. We still have 2 parts, okay? So these are the references. Thank you for your time. So please watch the second part and the third part. God bless.